I see that we are all logged in and we're about to start now. Good day, colleagues. First and foremost, I'd like to welcome you and thank you all for making time to attend this workshop. This is a COVID-19 workshop which serves as an awareness to get more understanding about this COVID-19 pandemic. Well, as we understand the current situation that we find ourselves in and the government regulations that we need to comply on, we could not be able to conduct this workshop the normal way. That is to conduct the workshop in a set venue where we can all be able to have a direct interaction. The director have only given permission to conduct this workshop through Skype Business or on Microsoft Teams. I think that was due to the university policy which encourages social distancing. That as well is also the national regulation. Due to the fact that we're working remotely, colleagues, with limited resources, such as we do not have the projectors, I will only share my presentation here on screen, and this presentation will be available on request. That's what I just thought I should just highlight to you. Okay, let me start by introducing myself. My name is Lwandile Nonzele. I am the current Human Resource Development BTech student at CPUT. I'm also the University of Cape Town employee. I'm working for bursaries and loans at Financial Aid Office. Because I'm conducting this workshop to the same section, I do not think it is important to give an opportunity for you to introduce yourselves, but you can indicate on the comment section if you think I should afford you time to do so. Okay, colleagues, let me first set the ground rules. Ground rule number 1. I would appreciate if you can switch off our cell phones during the course of the workshop or to put them on silent mode if possible. I would like to ask for your participation. Please mute all your mics and only unmute your mic when given an opportunity to do so by the facilitator. At the end of the workshop, I will afford you time to ask questions, but should you wish to raise a concern, to pose a comment, or to ask a question during the course of the presentation, you are more than welcome to do so. You can only do so by writing on the chat tab here on Microsoft or by pressing the hand tab icon so that I can recognize you and allow you to unmute your mic and talk. I would like if we can respect each other in a sense that when someone is given a chance to comment, we can all give that particular person time to finish up what he's saying, meaning that I would like one person to speak at a time. Colleagues, you are allowed to switch off your cameras to save data, but I will leave mine on. The first slide is the introduction slide, which highlights the topic that I am going to share with you. On the first topic, I'll define COVID-19. What is COVID-19? I'll touch base on the stages and symptoms of COVID-19. What are the main types of transmissions, specifically here in South Africa? What are the ways of preventing COVID-19? What is expected of you to do should you get infected? What is the treatment for those that have been infected? Lastly, I will also touch base on the national statistics in South Africa. The purpose of this workshop is to raise awareness on COVID-19. This training is conducted to UCT staff on aspects of COVID-19, and this is just a half-day training. The outcome is to acknowledge the reality and nature of COVID-19, how COVID-19 is transmitted and treated, and to understand what to do if you are infected. What is COVID-19? It is an infectious disease. By that, I mean it is contagious. It is spread from one person to another by direct or indirect contact. The COVID-19 started in China. The first human cases of COVID-19 were first reported by officials in Wuhan, China in December 2019. And by that time, it killed a lot of people and have started to spread across the world to so many countries, where it killed so much people in countries like Italy, Spain, America, and other countries. But on the 5th of March 2020, the first suspected case of COVID-19 have been tested in South Africa, KwaZulu-Natal province. It was after the patient consulted a private doctor on the 3rd of March, 2 days before, with symptoms of fever, headache, sore throat, and a cough, which are the common symptoms of the COVID-19. Then the nurse took swabs and delivered to the lab. Thereafter, it was confirmed that the patient really had been contracted the virus. So, this patient was a 38-year-old male who traveled to Italy with his wife. Way before the South African case was confirmed, COVID-19 was initially declared the outbreak by World Health Organization on the 30th of January 2020 and was later declared a pandemic on the 11th of March 2020. As of the 9th of July 2020, more than 12 million cases of COVID-19 have been reported in more than 188 countries and territories, resulting in more than 550,000 deaths, but more than 6.61 million people have recovered. That is good news, colleagues. So that is how the virus came into being in South Africa. It is caused by a new strain of coronavirus. So there is a slight difference between coronavirus and the COVID-19, because coronavirus is a group of viruses that cause respiratory tract infection in mammals and birds. Humans are mammals. So coronavirus is an umbrella for all the viruses that affect the respiratory tract infection. And the combination of all those viruses that affect the respiratory tract infection, we refer to as the coronavirus. So basically, that is the difference between the COVID-19 and the coronavirus. So, as mentioned earlier on, it is primarily spread between people during close contact, most often via small droplets produced by coughing, sneezing, and talking. COVID-19 affects different people in different ways. Most infected people develop mild illness. Some develop moderate illness and recover without hospitalization. So the common symptoms include fever, cough, fatigue, shortness of breath, and loss of sense of smell. Let us touch base on the main types of transmissions in South Africa. Colleagues, the current evidence suggests that COVID-19 spreads between people through direct contact. It also spreads through indirect contact, which is through contaminated objects or surfaces, meaning that it also spreads through close contact with infected people via mouth and nose secretions. The secretions I am referring to could be the saliva, the respiratory secretions, and or secretion droplets. So these secretions are released from the mouth or nose when an infected person coughs, sneezes, speaks, or sings, for example. People who are in close contact with an infected person can catch COVID-19 when those infectious droplets get into their mouth, noses, or eyes. There are so many ways to prevent this pandemic. It is essentially to thorough clean hands regularly with soap and water or an alcohol-based hand rub product. You also need to clean or sanitize surfaces regularly. Avoid contact with these droplets. It is important to stay at least 1 meter away from others. Cover the mouth with a tissue or bent elbow when sneezing or coughing. When physical distancing, standing 1 meter or more away, is not possible, wearing a fabric mask is an important measure to protect others. How to wear a mask? You first need to clean your hands. Cover your mouth and nose. Avoid touching the mask all over while using it. Do not reuse single-use masks. Remove it from behind. When you're actually removing the mask, you need to remove like this. And when done so, discard it immediately in a closed bin after use. The question is, what to do if you are infected? If you have or experience the mild symptoms, self-isolate and contact your medical provider or COVID information line for advice. The corona, if you are infected. If you have experienced mild symptoms, isolate and contact your medical provider or a COVID-19 information line for advice. The coronavirus hotline is 0800 029 999. Alternatively, you can just send a WhatsApp message to this number 0600 123 You need to stay in a separate room from other family members and use a dedicated bathroom if possible. You need to clean it and disinfect frequently touched surfaces. If you feel sick, you should rest. Drink plenty of fluid and eat nutritious food. South Africa is one of the few developing countries experienced an increase in the proportion aged 60 and over from 6.61% in 2002 to 8.01% in 2016. The population of South Africa is estimated to be 57.78 million. As of the 1st of August 2020, there are 2,959,535 tests conducted. Of all these tests that were conducted, 493,183 positive cases were identified. 8,005 death cases were reported. And that marks the last slide of our presentation, colleagues. Is there any questions or comments? Any question? If there are no questions, I would like to thank you, colleagues, for your time and hoping that you'll keep safe and healthy during these trying times. Goodbye.